It's easy to assume that supplements are harmless, but they're not regulated like medications, and what's on the label is not always what's in the bottle. I'm Dr. Berens, a family physician and founder of Vida Family Medicine in Houston, Texas, and today I'm going to share what you need to know before adding any supplement to your routine and how to stay safe while supporting your health. So first of all, most people who are starting a supplement are doing it for a specific reason. Often they've been diagnosed with a deficiency of some kind, or a physician has recommended that due to their medical condition, they need to have more of something, and so they take a supplement. But other times, someone may have seen an ad or a post on social media or heard from a friend that a supplement is going to improve their health in some way. So there's a variety of different reasons that someone might decide to take a supplement. And supplements that are taken to correct a deficiency or for a specific medical condition are often different than the supplements that are making general claims to improve something about your health. Supplements to correct a deficiency, such as like vitamin B12 or vitamin D, these generally contain only one ingredient and they clearly mark the amount of the dose on the bottle. So that's very important to know. Supplements that claim to prevent or treat a disease or condition often contain a number of different ingredients, and they usually say it's in some sort of proprietary blend. So sometimes you don't even know exactly which ingredients are in it or how much of each is in it. And this information is super important to know to be able to determine if a supplement is safe for you, because you need to understand what you're taking and the dose of it to know that it's going to be safe based on your personal medical history, any medical conditions you have, and any other medications you might be taking. The other important thing to know is that supplements are not regulated by the FDA. So according to the FDA website, supplement companies are responsible for having evidence that their products are safe and that the label claims are truthful and not misleading. However, as long as the product does not contain a new dietary ingredient, meaning one introduced since October 15, 1994, the company does not have to provide this safety evidence to the FDA before the product is marketed. Although they are recommended to follow good manufacturing practices to ensure proper manufacturing labeling, they don't actually have to prove to anyone that what is written on the label is actually what is inside the product before it is sold. And this can make it very difficult to know what you're taking and how much. In fact, there is a study that was published in JAMA in 2023 that studied the content of melatonin supplements marketed for children, and they found that only 88% were accurately labeled, and they contained between 74 to 347% of the amount of melatonin listed on the bottle. So that's a huge difference. It's super important to understand. Some supplement companies do submit their supplements for third-party testing to ensure quality control, and that means that a separate organization that does not have a financial conflict of interest has tested and verified that the supplement contains what it says it does in the amount that it says it does without anything else being added. However, this is the exception more than the rule. Supplements are also not subject to the same level of scrutiny as medications to evaluate whether they are safe and effective. So before a medication goes through FDA approval, there are multiple studies and data that has to be submitted to the FDA to prove that it is not only safe but also effective for treating the condition it claims to treat. A supplement company does not have to provide proof that their supplements are safe or effective. They get around this by adding wording on their label saying this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. You've probably seen that on the bottles of supplements when you purchase them. They often will say things, though, like thyroid support or liver detox. So rather than specifically making a claim that they're preventing or treating a disease, they're certainly implying it by what they've called the supplement. And while this softens their claim from a legal standpoint, it doesn't actually change the fact that they're still marketing the supplement as a method of prevention or treatment for a disease. So my tips for navigating supplements. Number 1, only take supplements that are specifically recommended by your physician due to a diagnosed deficiency or an increased need due to an underlying medical condition. So for example, iron if you have iron deficiency anemia, or a prenatal vitamin that contains folic acid while you're pregnant. Number 2, look for supplements that contain only the specific ingredients you need and list them all clearly with dosages. So avoid those proprietary blends. Number 3, look for verification that the supplement product you're using has been third-party tested for quality control. So in the US, the options include NSF, USP, and consumer labs. Typically, if they have been reviewed by one of these organizations, there's a seal on the bottle that will confirm this, or you can look it up on the company's website. And remember, third-party testing does not confirm that a supplement is safe or effective. It only confirms that it contains the ingredients that are listed on the bottle in the amounts listed on the bottle. If you're considering adding a supplement to your routine, ask yourself what you're hoping the supplement will do for you. Discuss with your physician what the evidence is that this supplement will help with your goals and what other evidence-based methods there may be for working towards that goal. If you're going to spend money on something that you're going to put into your body, you deserve to know what the potential risks and benefits are of that decision. And number 5, if a supplement company is using social media influencers or multi-level marketing to market their product, or it's being sold to you directly by a healthcare practitioner or a trainer in a gym, take extra caution in reviewing the validity of their claims and the potential risks. They are more than likely a very profit-focused supplement company and hoping to gain market share either with designer packaging or broad claims with a big appeal to their market, or in some way they are providing a financial kickback to the person who's recommending the product to you. For example, in a doctor's office, a chiropractor's office, to a trainer. It's really important to understand that it is impossible to be objective when you're sharing the risks and benefits of a product when you are being paid directly by the company that makes the product, or you're directly profiting from the sale of that product. You cannot be objective as much as you may try. And when you need a supplement, the vast majority of the time, there is an affordable, high-quality option available in your local grocery store or pharmacy. You don't need to go through one of these designer-marketed supplement companies. So keep watching for my next video when I'm going to review in more detail the potential risks associated with supplements and how to avoid them. And be sure to subscribe for more practical evidence-based health guidance. And if you're in Texas and looking for a primary care doctor, I'd love to support you. You can learn more at vidafamilymed.com.